tinay si call last time, nung Monday, is to show you the anterior fascial compartment of the thigh and the leg, as well as the muscles and the dorsum of the foot. Okay, so let's begin with the thigh region. Okay, so the most prominent structure here is this obliquely oriented muscle known as your
Sartorius.
Okay, so this is considered as the longest muscle. What's the action of sartorius? Remember the mnemonic FABER. Flexion, abduction, external rotation. Okay. Are you all familiar with the quattro?
Yes.
You place your leg on the other extremity. Okay. That's the quattro. That's the action of That's the action of
The sartorius.
sartorius. You flex, okay? You abduct the thigh, and you externally rotate. Okay? So that is your... Now, there is a triangular depression. May scissor kayo. Wait lang ha. Kunin ko lang to. It is a triangular depression on this area. We call this your femoral triangle. Ang daming femoral na name di ba? Femoral ring, femoral canal, femoral triangle, femoral sheath. Okay? So the triangular depression here is your femoral triangle, bordered by sartorius laterally and adductor longus medially. Okay? Then the base is formed by the Popart's ligament or your inguinal ligament. So you have your inguinal ligament here. Okay. Now, the contents of the femoral triangle is anong mnemonic natin?
Navel.
Your navel. You have your nerve, artery,
vein,
and lymphatic.
empty.
It is arranged from, is it from medial to lateral or lateral to medial? That's lateral to medial, so NAVL. Okay? So, you have here the femoral nerve. Okay? That's the N. This is the letter A. It's the femoral artery. And that's the V. Okay, that's
Vein.
the femoral vein. Then you have here a portion of, tinanggal na yesterday, last Monday, it's the lymph node. Okay? Now, among the four structures, it is only the femoral nerve that is not encased by the femoral sheath. Can you follow? Again, you have your femoral triangle. You have the femoral contents. You have the navel from lateral to medial. Then, dun sa artery, vein, and nerve, artery, vein, lymphatics, it is only the nerve that is not encased by a femoral sheath. Okay? Now, your femoral lymphatics, the most medial part, has its own compartment. Okay? We call it the femoral canal. Nakuha yung difference. Okay? Now, the opening of that canal, if you have the canal, meron siyang opening sa taas. Okay? That is your femoral ring. Can you follow? So, you have the femoral triangle. Within the triangle, you have the sheath, which is not included.
Femoral nerve.
Femoral nerve. What is the content of the femoral sheath?
AVEN.
The artery, the vein, and the lymphatics. The lymphatics has its own
Femoral
compartment called the femoral canal. The opening or the superior opening of that canal is the femoral ring. Can you follow? Okay. Now, what about the subsartorial canal? From the name subsartorial, it is found under the sartorius. You think of the subsartorial canal as the continuation of the femoral triangle. Are you all familiar with the shape of the funnel? Okay, yung embudo. Okay. The triangular part of the embudo is the femoral triangle. Okay? Then the tube-like, that's the subsartorial canal. So if this is the embudo, or the triangular shape of the funnel, under it is your, this one. That is your subsartorial canal. From the name subsartorial, it is under the sartorius. See? Okay? So with the sartorius intact, this one is a tunnel-like structure. Okay? Can you follow? Okay? Now, what is seen in your femoral or in a subsartorial canal is the femoral artery, your femoral nerve, and your femoral vein. Okay?
Band.
And then this will terminate, these neurovascular structures will terminate in your adductor hiatus. Now, if I'm going to place my finger in this area, pumapasok yung finger ko, it's because there is an aperture or an opening created by the adductor magnus. We call it your adductor hiatus, to which the neurovascular structure, except against the nerve, will pass through it. Okay? Now, beyond that point, the name of the artery will change to popliteal. Can you follow? Okay? Now, the nerve will stay on the anterior fascial compartment to supply the muscles in the anterior fascial compartment, such as, again, your sartorius, your quadriceps. And what are the components of quadriceps femoris? You have the rectus femoris. Then you have the three heads of vastus medialis. This is the vastus intermedius. Okay? And this is the vastus lateralis. Okay? Now, this band of fascia here, this is your iliotibial tract or your iliotibial band. This is the tendon actually of the tensor fascia lata, this one. You have a muscle here which will become tendinous on the lateral side, known as your iliotibial band or fascia. Okay? Now, your gluteus maximus will also insert or will blend with the iliotibial tract. Now, you notice that the iliotibial tract will end in the knee joint, in such that contraction of the tensor fascia lata will extend your knee joint. Okay? As well as contraction of the gluteus maximus will pull through the iliotibial band and will result in the extension of the knee joint. That is why every time you tighten your butt, okay, your knee will extend. Diba? Okay, so your quadriceps femoris will terminate on top of the patella and become tendinous after the patella. Now, the tendinous portion of the patella, known as the patellar tendon, will insert in the tibial tuberosity. Okay? Now, what is the purpose of the patella as far as the quadriceps femoris function is concerned? This will serve as a lever for the full extension of the knee joint. Without the patella, incomplete. Sinabi ba sa physio, sa muscle physiology regarding passive and active insufficiency? Okay? Pag nag-contract ang muscle, okay, di ba sinasabi sa muscle physiology, pag nag-contract ang muscle, if it is too short, okay, pag yung overlapping ng mga cross bridges, masyado ng short, hindi na siya magko-contract or the contraction is inefficient. Same is true if the muscle is super lengthened to the point na wala ng cross bridges na mapo-form. Hindi rin effective yung contraction. So which one is the active insufficiency? Which one is the passive insufficiency?
Active.
If shortened, that is active. Okay? Pag lengthened, that is your passive insufficiency. Same, ganito yung application yan eh. Mas madaling mag-flex ng fingers if it is in neutral position. Kasi maganda yung cross bridges ng muscle. But, if you overflex your wrist joint, medyo mahirap mag-flex. Okay? Mahirap mag-flex simply because of active insufficiency in your forearm flexors. Kasi masyado nang malapit yung cross bridges. To the point na wala na siyang nakapitan ng mga myosin. Right? Same is true with the extensors. Okay? Hindi rin ganun ka-effective yung muscle simply because masyado siyang lengthened. Hindi na nag-overlap yung ano. So that's the role of the patella here. Okay? Para magkaroon ng proper length yung quadriceps femoris for the full extension of the knee joint. Okay? Now, what about this muscle? This is your gracilis muscle. Okay? Now, yung mga side muscles, you have your adductor longus, you have the adductor brevis under. Okay, this one. Then you have the adductor magnus. Okay? Now, andito sa ilalim, pag tiningnan nyo siya sa ilalim, later tingnan nyo na lang, you have the obturator nerve. Okay? Na madali lang mag-memorize ng innervation dito. Lahat dito, femoral nerve. Lahat ng nasa medial side,
side,
obturator
obturator.
nerve. Lahat ng nasa ilalim, sciatic nerve.
Okay.
Okay? Now let's proceed with the leg. Okay? Now to understand the leg, to be able for you to be able to identify the muscles of the leg, you should have a good view of the tendon in the dorsum of the foot, because this will tell you anong belly to. Because without the tendon, without the view of the tendon, it's very hard to identify kung anong muscle belly to. Okay? Now, the most medial muscle here, which will terminate on top of your navicular, and dito yung navicular bone, this is your tibialis anterior. This is your main dorsiflexor of the ankle. Okay? Now, you will notice that the direction of this tendon is going to the hallux. Okay? Making this your extensor hallucis longus. Okay? Now, the next muscle is one. Okay? You notice that it divides into 4 slits of tendon. 1, 2, 3, 4. Making this your extensor digiti minimi. Sana makita nyo to. Now, there's the 5th tendon here that will terminate on top of the cube of the peroneal tubercle. Okay? This is your peroneus tertius. Ito yon. Okay? This is the peroneus tertius. That's your clue for the peroneus tertius. It's beside the extensor digitorum longus, and the tendon will proceed to the peroneal tubercle. Okay, that's your peroneus tertius. So everything here is supplied by the superficial or deep peroneal nerve. It's your deep peroneal nerve. Okay, anterior fascial compartment is deep peroneal nerve. Okay, now if you're going to remove, by the way, if this is intact, you have here the presence of the extensor retinaculum. There are 2, diba? The superior and the inferior. The superior is somewhere here. The inferior is somewhere here, which is, what is the shape? Y shape.
Y shape.
Okay, nandito yun. Okay. Now, I try to remove the extensor hallucis longus to be able to expose the anterior tibial artery. This is the anterior tibial artery. Okay? Can you still remember the popliteal artery behind in the popliteal fossa? Diba this will divide into 2. The anterior tibial and the posterior tibial. The posterior tibial will supply the posterior fascial compartment, whereas the anterior will pierce the interosseous membrane and will supply the anterior fascial compartment. So, ito yun. Okay? And this is accompanied by the deep putol ko ba? This is the deep peroneal nerve. Okay? Ito. This is the deep peroneal nerve. Okay? So, galing dito yung deep peroneal nerve. Ano naman yung pinanggalingan ng deep peroneal nerve? You have the sciatic nerve dividing into common peroneal and tibial nerve. The common peroneal will course in the fibular head and will split into 2. A deep branch and a superficial branch. So, what is shown here is the deep branch of the peroneal nerve. Here. Okay. Now, as it reaches the the ankle joint, the name of the anterior tibial artery will change to dorsalis pedis. Okay. Can you follow? So, ito na yon. So, this is part of the dorsalis pedis. Ito na yung continuation. Then, this will form your arcuate artery. Okay. Now, what about the muscles in the dorsum of the foot? Okay. Okay, can you appreciate this small tendon here? Ito.
Yes.
Okay, ito yung muscle belly niya. Okay. The tendon goes to the hallux, making this your extensor hallucis brevis, because you have the longus here. This is the longus. Okay. Then dun sa ilalim, okay, if you try to dissect this one further, you will be able to expose 4 tendons with a single belly. Then that is the extensor digitorum brevis. So the 2 muscles is supplied by the deep peroneal nerve. Okay, can you follow? Okay. Now we will move to Sapkadaver.